A very good evening to one and all. Thank you for joining us this evening for this very interesting webinar. My name is Ankita. I am from the Marketing and Corporate Relation Personnel of the University of Manchester Middle East Center. And I'm very happy to have Dr. Reza with me, who will be presenting this webinar to all of us, talking about the most wanted content and topic related to the pandemic, which has actually covered the entire globe. For those who have been interacting with us in past, they know Dr. Reza. But for those who have joined us um, as a newcomer of conversation, let me quickly give a brief about our speaker for this webinar. So Dr. Reza is an associate professor and senior lecturer at Alliance Manchester Business School at the University of Manchester. He received his PhD from London School of Economics and Political Sciences, and his research interests include corporate productivity and growth, health economics, and digital transformation. Dr. Reza is a very active researcher and his recent published researches are all highly topical in our fast transforming world. And today, he will discuss how the COVID-19 pandemic can lead to a deep recession across the globe, explore the likely nature of the recession, and reflect on long-term strategies that firms should pursue to navigate the current unprecedented challenges. While he will do the presentation, if you have questions and concerns, feel free to mention that in the chat box or the question box, which you can see on the right side of your screen, hopefully, and we will pick up those questions as soon as the presentation is over. So on this note, Dr. Reza, I welcome you on board and please take the audience.
Thank you. Good evening to everyone. So let me just make sure that could you see my screen now? Okay, so
no, doctor. Yeah, now it's visible.
Yeah, but I think the screen is occupied with myself, which is not a good idea. So let me minimize this one. So you can see my screen now. Am I right?
Yeah, we can.
Wonderful. Yeah, excellent. Thank you very much for joining me this evening. I'm going to give a talk on pandemic crisis, the current challenge that we have across the globe in many countries, starting from China, spread basically to Europe and other parts of the world. It's a huge topic. Basically the way that the economies responded in different parts of the world are different, so it's very difficult to cover it in a single talk. So instead of talking of specific countries, I'm going to talk of basically theoretical framework, how we basically understand these recessions and look at some historical data to see what type of recessions we have, how deep this recession would be, how long would it take, and then draw some conclusion and implications for corporate behavior and corporate responses. So that's basically the plan of the talk. As I said, although I will be drawing on lots of data from different places, but the discussion would be general. But I would be more than happy to answer questions, specific questions, when we finish basically the discussion. So the first thing that we're going to emphasize in understanding this recession or this crisis is to reflect what type of crisis we have in economics. So normally the way we think of recessions and economic crisis, we start with a shock. So the economy is in a good shape, and then all of a sudden the economy experience a kind of a shock, and that shock propagate throughout the system, and then the economy basically goes into recession. That's the big picture that we have. So in economics, so the idea is that the whole system is quiet and is basically acting normal, behaving normal, and then all of a sudden we have a shock, and that shock basically propagate through the economy. There are different type of shocks that we can think of it. Sometimes the shock is actually very global. All the dimensions of the economy are impacted and affected, but sometimes shocks are local. For example, in the case of 2007, 2009, the credit crunch, the financial basically recession that we had, there was a shock to the financial system, and that basically shock propagated through the system. When the shock is such that basically all dimensions of the economy are affected, we call this type of recession as systemic crisis or systemic recession. Systemic recession or systemic crisis refer to those recessions that the economy basically experiences the shock, but the shock is so basically powerful that all basic sectors of the economy are affected, both the financial segment of the economy and the non-financial part of the economy start experiencing difficulty. This type of crisis or this type of recession, we call it systemic recession or systemic crisis. This is basically systemic crisis, but sometimes the economy goes into recession. For example, one part of the economy goes into recession, like the construction sector or like the manufacturing sector, but the other part of the economy continue operating. So there are different types of recessions, but the kind of recession or the crisis that we're going to emphasize today is the concept of systemic crisis. It's a kind of a crisis that affects all dimensions of the economy. So the first, step in understanding the current recession is to think of it as a kind of systemic crisis or systemic recession. The other thing that is important to note is that sometimes the shock comes from within the economic system. Sometimes the shock comes from outside of the economic system. That's quite important. In the case of 2007, 2009, the financial crisis, the credit crunch that we had, so the source of shock in that case came from within the economic system. It wasn't from outside. But this time, the kind of shock that the economic system is experiencing is coming from outside the economic system. It's a virus that doesn't necessarily have to do at the start with the economic system, but as the virus is spread, it has an impact on the economy. So it's important to, when we're understanding recessions, or particular the current recession, is to think of it as a kind of a systemic crisis, but the source of this recession, the source of this crisis is external, it's exogenous. But in the case of 2007, 2009, credit crunch that we had in Europe and in the US and in other parts of the world, in that case, the source of difficulty, the source of challenge was from inside the system. This distinction is quite important in understanding how this recession, this current pandemic, is likely to evolve and what will be the impact on the economies. So the first thing is we're going to consider it as a kind of a systemic crisis, but the source of this crisis is coming from outside the system rather than from inside the system. That's the first thing that basically we need to pay attention to. So the other thing that is important to note is that the current recession that we have is to a large extent is the result of the health policies that different governments have put in place. So in order to deal with the virus, the different governments across different globe basically intervene and shut down part of the economy, and that's where the recession basically started, and that's the reason that the impact of the virus on the economy could be basically much stronger. So the way that we need to see this recession, and it's different from the past recession, is that we have a virus and the science basically propose certain ways to deal with virus, and as a result of that, the government across the globe put certain health policy, and these health policies had a negative impact in particular disrupted the supply chain in many, many economies, and that could possibly lead to a deep recession, and which affect the basically corporate responses and corporate behavior. So the chain of event again in this is different. So the current situation that we are in is different from the past recession that we have basically in our memory. Is that basically the source of shock is outside the economic system, and the economy might go to recession as a result of the health policies that different governments have put in place. So what is the implication of this? The implication of this is that if we're going to understand this current crisis, we have to understand the health policies that different governments put in place and why actually they put in this in place. That's quite important. Without having a good understanding of the health policies that different governments have put in place in different parts of the world, we can't actually trace the impact of the virus on the economy, and we can't talk of how the recession would look like. So quite quickly, I'm going to go through it before go to the economics and how basically how we need to think of this recession. I'm going to go through the science a little bit and the kind of models that led to the government responses and therefore the disruption in the supply chain. It is important basically to understand. So one concept that we have, so this current recession, we're calling the pandemic recession or pandemic crisis. What actually they mean by pandemic? There are different definition of pandemic. WHO has a definition, basically the Center for Disease Control in the US. They have a definition, but these definitions are quite close to each other. So CDC in the US, they define recession. So pandemic for them refers to an epidemic that has spread over several countries or continents, usually affecting a large number of people. So using this definition, the current situation can be interpreted as a pandemic. And of course, we know that the WHO, the World Health Organization, declared the current situation as a pandemic on 11 March. That's the first point to basically have in mind. Also, good to see whether we have historical cases in the past, what happened in the past pandemic, because always history can teach us a lesson. And indeed, the historical information that we have about the impact of pandemics in the past has shaped the decision that the government have made in dealing with the current recessions. So there are many different cases that we have, pandemic that we have in history. Some of them are basically quite recent, some of them are not recent, some of them are very serious, some of them are less serious. What you see here on my slide is the 3 cases of serious pandemics in the past. So the first pandemics that noted in the literature happened in 14th century. At that time, the population of Europe was around 100 million, and 25 million basically died. Almost basically 1 in every 4 basically group, 1 in 4, they died. So the impact was quite basically huge. The other pandemic that we have, which is more recent, was 1918 or to 1920. It started from Spain, and that led to basically a death of 50 million or higher. But 50 million is basically the lower limit estimate that we have. You can see how damaging the impact of a pandemic could be. A more recent pandemic that is in the literature, and these pandemics have guided the government policies, is the AIDS pandemic. So far, basically more than 25 million lives have been lost, and there are many basically infected with that virus, around 33 million. So what we can see by reflecting on historical cases, a pandemic could have a large impact on the population, and the policymakers, they had this basically in mind when they were making a decision. So that's the idea. These are the background to the discussion that I would like to have, the economic discussion that I would like to have. But without actually taking care of this background and noting this background, we can't understand the responses to the current pandemic, and as a result of that, the impact on the economy that the virus had. So regarding the characteristics of the COVID-19, it's also interesting to pay attention to it. It's a very contagious, basically, kind of virus. So each infected person can infect 1.6 or 2.4 other, basically, non-infected individuals. So it's very, very contagious. In particular, has effect, a negative effect on the older generation above 70. They are basically quite susceptible, and that could be quite damaging. These are the sort of things that basically we have, the information that we have regarding the virus. But at the same time, it's quite important to note, and that's very, very critical for understanding government responses to the recession. And what basically we need to note is that there are lots of uncertainties regarding the virus. So we don't know, for example, so there are lots of individuals that they have the virus, but they don't show the symptom. But we don't know whether this type of individuals, this infected patient, could pass the virus to others or not. That's basically one of the uncertainties that we have, and this uncertainty has shaped the policies across the globe. Another uncertainty that we have regarding this virus is that we don't know whether those who are infected are becoming immune, or basically they might get the virus again. That's quite important. And this piece of information is quite important for the decision whether to open the economy or not. So these are the things that we have. So this is what we know regarding the virus. There are more information, but that's enough for the discussion that we're going to have today. So what government policies have been trying to do? So here is we have basically two possibilities. So we have a distribution which is in red, and a distribution that is basically is in blue. This is the way that we need to start thinking about the government policies, the health policies that have been implemented across many countries across the globe. So the red distribution means that how many basic beds you need if basically intensive care beds you need if you don't intervene in the economy. So that's the distribution of the intensive basic care beds that a society and economy would need if there is no basically intervention in the economy. But the blue one represents the maximum of the intensive care beds that you need if you intervene and basically place certain policies like the lockdown in the economy. So what basically going on is this: the way that basically the government institution is start thinking is that what would happen to the basically the healthcare system if we don't put any measure in place. And what basically came out of that reflection is that you don't put any intervention and any health policy in place, the healthcare system would be overwhelmed, and basically the demand exceed the supply, and that lead to a large number of deaths. So the government policies, the health policies, was to actually intervene in the system, intervene in the economy, so that you don't eliminate the virus, but you bring the rate of infection down so that the health system is not overwhelmed. So the policies that different government have put in place, the immediate policies that different government put in place was to lower the rate at which basically the society is infected, so that the demand for the healthcare system does not exceed the supply, and the health system can continue operating and does not collapse. That's the setting of of the policy. 2 or 3 more minutes for the health, and before basically going to the economics, it's good to know you are the young generation possibly. It's good to know the literature a little bit before moving to more interesting part of the discussion, which has to do with the economy. So here is, because we are dealing with the virus, most of the models that the government institution have used to shape their decisions and to shape their policies came from epidemiology. So this is a typical epidemiology model that we have, and it's called basically SIR model, which is susceptible, infected, and recovered. These are the key basic elements in the model. So as we can see, we have susceptible, those individuals that have not been basically infected yet, but we have the infect and then they become infected, and those who are infected, some of them basically develop and become quite critical complications, and those who are basically become quite complicated, some of them die and some of them recover and become immune possibly. And another group of those who are infected, they don't show any symptom, and the impact of the virus on them is not in terms of health serious. They don't notice, and then they recover. This is the I mean basically the SIR model that the different government have used to shape their policy is quite interesting. And that's one of the reasons that actually I'm presenting this to you, because in this current situation, this model from a different field, from epidemiology, is actually impacted, affected the economic decisions. So the focus of government policies here is to control the replication number. So if you could see my slide, I have R0. This is a very critical number, a critical coefficient in SIR model, and that's called the replication number. So as I said, if you don't do any intervention, this virus could infect every person could infect up to 2.4 people, which means that the virus would spread quite quickly. That's R0. So what the government policies have been trying to do is actually to control this R0, so that it doesn't basically, the rate of, infection is not that high. So this is a replication number, R0, this is quite critical. So there are different. So what is basically how they they tried basically to control this, is the only way that you could control, to put it very, very simply, is by reducing an interaction between individuals. So the focus of the government health policy is to control the replication number R0, and what is actually how you could do it. An important way to basically, at least at the start, was to reduce interaction, social interaction between people in the society. And to put it differently, lockdown was a solution to reduce the replication number. So there are two types of policies that we can actually think of it. One is called containment, and the other one is called suppression. This is very important for understanding what type of recession actually we are dealing with. So there are two types of strategies. Suppression basically means that you introduce heavy health intervention in the society. You impose restrictions, strong restrictions on social interaction, so that R0 comes below 1. So that, if a person is infected, does not have any chance to infect others. So suppression means that you introduce heavy and a strong health intervention and social distancing in the society, so that if someone is infected, because he or she does not have any contact with others, basically the R0, the replication number goes below 1. And if you do that, of course, soon the virus would die. Or the number of infected, the fraction that were infected in the society quickly goes down. The other policy is called containment. It's not as strong. The idea behind containment policies is that to control the replication number close to 1, not necessarily below 1. So a person who's infected might infect another person. So if R0 is equal to 1, that means that each person infects another person. If you can control it, this is that you can contain the virus. So these are the two ways that different governments have gone, and this is quite important for understanding the kind of recession that the economy would experience. So as I said, one of them is containment and the other one is suppression. So each of these have certain advantage and disadvantage. The containment, which basically keep the replication number close to 1 allows herd basically immunity to build up in the society. So because the people got infected at a higher rate, immunity build up in the society, and soon basically everyone has, in a sense, been exposed to that virus and in a controlled manner, and then I mean, we have a herd immunity. But suppression is trying to bring the replication number R0 below 1, and through introducing tough and strong social distancing, and that could basically what it manages, it enables us, the policymakers, to deal with the virus quite quickly and control it quite quickly, but it stops the population building herd immunity. And as a result of that, when you introduce tough health policies to control social distancing, you can control through suppression the spread of the virus, but you don't let the population to build herd immunity. So if in the future you open up the economy, then there's the chance that the virus come back and you need to do it again. So there could be different waves of infection. That's very, very important. The reason actually I'm going through these things because of these subtleties, that different policies have different implication. Containment means that in the short run, lots of people become infected, and there might be basically a lot more death, but it allows the population to build herd immunity. Therefore, you don't have many waves of infection. But suppression, having sharp and strong health policies, means that you bring the virus quite quickly under control, as we have done in Spain and Italy, for example, reasonably quickly, or in South Korea. But if the, when you open it up and you don't put any other measure in place, you might have another wave of infection. And then when we look at the past, this basic graph that you see, this is for the pandemic in 1918. What actually you see here, that's for the UK, that in 1918 to 21, because of that pandemic, there were different waves of that virus, and the second wave and the third wave, they were much stronger than the first wave. This is one of the uncertainties that we have regarding this, when the recession is going to end. That's one of the questions that we're going to touch on it. That has to do with this information that at the moment we are discussing. So when the recession is going to end, to some extent, is whether we would have different multiple waves of infection or not. But when you look at the past cases, like in the case of 1918 pandemic, we could have basically different waves of infection. So this is the setting. So what was the government decision? How the government? So the government has two policies. They could go for containment or they could go for suppression. So when you look at the different policy approaches that a government could take, one was to contain the virus so that the replication number is close to 1. The other one is to actually to suppress it. So they put it basically very simply, and because we don't have much time, is that the basic model that we had in epidemiology shaped to large extent, as I said, government policies. So this model that you see on the screen, that's from Imperial College in London, that they modeled basically what would happen under different scenarios. And that shows the number of intensive care beds that we would need in the UK per every 100,000 basically population. So what basically we see here is that if the government does not do anything, for every 100,000 in the UK, the government would need 250 or more than 250 intensive care beds. And if, for example, they close their school, they need a much lower. So all these estimates was saying that if you don't intervene in the economy sharply and quickly, then the number of intensive care beds that the health system needs would be very, very high. And also, the model predicted a large number of deaths in the population. So in the case of UK, the prediction was that more than 500,000 would die, and the prediction for the US was that 2.42 million actually would die as a result of this pandemic. So these predictions were very, very basically stark and very strong, and that shaped the government policy. And the consideration that shaped the government policy is that is the healthcare system constrained, capacity constrained. So the number of intensive care that we have in the UK and in the in many other countries are very, very low. So for example, in the UK, for every 100,000, we have only 7 intensive care beds. So the capacity was very constrained. So you have a situation that your best epidemiological model predict basically the a high number of intensive care beds that you need if you don't do anything, and a high number of deaths, but at the same time, your health system has capacity constraint. The number of intensive care beds that you have is very limited, and all these considerations actually led the governments to go for suppression rather than containment. This is very important, very important. So the government, in many countries, they went for suppression rather than containment, which basically means introducing sharp social distancing in the economy. Social distancing in the economy. So this is basically the summary of the discussion that we had. Now we're going to move on to the economics part of the discussion. So we had model uncertainty, though there are many different models, but the models predicted a high number of deaths and a high number of intensive care beds that you need, but the health system had capacity constraint. As a result of that, the government actually they move, and because of the these concern, the government went for suppression rather than containment. So the government decided, at least in the short run, introduce a strong social distancing and lockdown in the economy to contain the infection, so that the health system can cope with the infection rate and the number of infected people, so that we can save life. So that's the background. And indeed, this is the graph that we have for Spain. So Spain is one of those countries that they introduced a strong lockdown at the start, and you can see that R0 went below 1. So it became 0.74. So that means that an infected person does not have much chance to basically infect another person. So, the policy was quite effective in countries like Italy, like Spain, and like South Korea. As a result of the strong lockdown that they had, they pushed R0 very basically below 1. So that's the health part of the discussion that we have today. What about the economics? What about the economics? How actually we need to think of the current recession that we have? So in countries like it started with China, South Korea, and that part of the world, and then Italy, Spain, and Europe, and the United States, and other part of the world. So that's the pattern that we see for the spread of the virus across the globe. What actually we see here is this. So the immediate impact. So now we're going to start the economic part of the discussion. The immediate impact on the economy was a disruption in the supply chain. So what basically lockdown did immediately, it disrupted the supply chain. The supply chain. So in China, the supply chain was disrupted. In South Korea, the supply chain was disrupted, and as a result of that, the supply of output and intermediary product went down and was disrupted. But because is the supply, the global supply chain is highly interconnected, as you can see from this, which is come from IMF and World Bank. So the global supply chain is so basically interconnected and is like a network. This initial supply basically shocks that basically occurred in South Korea and China is spread across the globe. So we have an initial supply chain basically shock. So the global supply chain disrupted, experienced a difficulty at the start, but because we had a kind of a global supply chain, that shock propagated basically into the system and affected other economies like the UK or German or Japan or basically the United States. So that's the first point. So in a sense, if you have done economics before, the initial impact of these health policies, which was basically lockdown and distancing disrupted the supply chain, and that disruption is spread across the globe because we have a kind of a network, a kind of global supply chain, and in many countries, they experience a negative supply shock. And so in economics, the way that we show the negative supply shock, we say that the supply line shift to the basically left. So here, what you see in my graph is that I have a demand line that's AD, that represent the aggregate demand in the economy, and I have an AS line that's aggregate supply. As a result of this basic pandemic, the, the supply basically went to the left. That means that the supply actually declined. So the initial supply shock pushed the AS curve, the aggregate supply, to the left. That's how basically we see. What is actually important is this. The next point to emphasize is that when the supply is affected, and some basic industries like the hospitality industry and restaurant and this type of industries is stopped, then the demand side of the economy also affected. So although the negative shock, the negative experience that the economy experienced, started from the supply side, but the demand side of the economy also was affected. So those who have, for example, they lost their job, they did not have that income, or their income become uncertain, and for that reason, they reduce their consumption. Therefore, the demand in the economy went down as well. That's quite important to emphasize. So you have supply shock, the aggregate supply shift to the left, but because some segment of the economy are shut down and they are not operating, the workers in that segment, not only the supply from those basic parts, not only supply from hospitality sector, from the airline sector, from the restaurant sector, not only the supply from those sectors have gone down, but those who are working, the workers that they were in those sectors, their income disappeared, and or their future income became uncertain, and as a result of that, the demand also go down. So not only the supply actually, the aggregate supply curve shifts to the left, the demand line also basically shifts downwards. So we have in a sense, the supply shock induced a demand shock, induced a cause basically demand shock. Supply went down, and as a result of that, the demand in the economy went down. And of course, when the demand goes down, the supply also goes down, because basically when people are not buying, and then the suppliers, they further reduce their supply. So what we see basically, what is happening, and that's important for understanding the current recession, is that there's a race between supply and demand. The initial shock to the economy was a negative supply shock, but that negative supply shock induced a negative demand shock. Demand went down. But when the demand goes down, the supply also further goes down. So if you were working basically in a restaurant and you no longer have income, possibly you don't buy a new car. So the demand for new cars have gone down quite significantly. either because you have lost your income or because you are uncertain regarding your future income, the demand for car goes down. And of course, when the demand for cars goes down, the supply of cars also go down. So there's a race between in this recession, there's a race between supply and demand. Aggregate supply went down, pushed aggregate demand. Aggregate demand went down and pushed basically aggregate supply further down. That's the kind of, so we have a kind of a feedback system, and that's what the economy basically experience, and that's very important. So the kind of recession that we have is a kind of recession that there's a race, there's a kind of interaction between demand and supply. Supply goes down, demand goes down, demand goes down, supply goes down, and then on and on. That's basically the dynamics that started in the economy. And as we can see, as a result of that, the output in many industries went down quite significantly. This is the data that we have, for example, in the US. The leisure industry went 42% down and 34%, for example, in transport, and then so on and on. Construction basically went down. So what this then, so we had the government policies that started as health policies. Then in order to stop these dynamics in the economy, to stop this race between demand and supply, what the government across the globe have done, they have introduced important economic policies. So in Europe, in other parts of the world, in South Korea, in the US, so the central bank, in order to stop this dynamism, this race between supply and demand, they basically what they have done it, they came up with policies, and the idea is that whatever it takes, they have done whatever it takes to stop this dynamics. So, I mean, the kind of stimulus and economic intervention that, for example, in the US they have done, or in the UK, or by other part of the world, to stop this rate, it's been phenomenal in the sense they even during the financial crisis, the stimulus was not as big as what they have done. So one of the consequences of this government intervention, economic stimulus, is that the debt, government debt, has significantly gone up or is going to go up. That's one of the basic points that we're going to discuss a little bit later, and that's basically quite unique to this recession, that has increased government debt, public debt, across many parts of the world, So that's the all the indication is that we could have basically a deep recession. So as a result of this dynamics and race between supply and demand, we could have a deep recession. So it seems everyone agrees that most of the economies across the globe are moving towards a recession. One of the question is, what type of recession? Basically, that different types of recessions, what type of recession we would have. So one type of recession that we have is called the V-shaped recession. What does it mean? This is basically the first type of recession. It means that the GDP goes down sharply as a result of the lockdown, but as soon as you remove the lockdown, then the economy recovers quite quickly. So this is one hypothesis that we have, that the economy would experience a V-shaped recession. The decline is very, very sharp, but that's quite short term. As soon as you open, then we have basically a V-shape. Then another one, they call it U-shape, and means that as a result of the lockdown, the decline is very, very sharp, but the recovery is much gradual. And that's another basic possibility that we consider. And then the third one, there are other types, is called L-shape. What does it mean? It means that as a result of the lockdown, the economy goes down quite sharply, but it never come back to the level that it was. So the dotted line here in this slide reflect and represent how the trajectory of the economy if there was no recession. The dotted line represents the trajectory of the economy if there was no recession. But what basically this possibility means is that, and what basically we see here, the economy goes down, it starts recovering back on a different path, not basically the same path. It doesn't return to the same level that we have. So one of the challenges that we have is at the moment is to predict which actually type of recession that we have. It seems that everyone is accepting that a recession would be there, but which type of recession is, there are different possibilities, and there are. So it's very difficult in this basically say in this case is that in a sense without knowing something from basically epidemiology regarding the virus, we can't say which type of recession we would have. Everything goes back at the end to whether basically there will be a treatment, there will be vaccines, or when a vaccine would be available, and whether basically we would have, other waves of infections in major economies. These are the kind of uncertainty that we have. So because of that uncertainty, it's very difficult to say that actually the recovery could be quite basically sharp. So even if you open up the economy, because of the uncertainty that exists, the demand would not come back. The demand would not come back, and when the demand does not come back, then those who have lost their job, they can't go back, and they can't recover their job. Therefore, the production level in the economy remain basically low, and more likely, the kind of recession that we have is either a U-shape, a very gradual recovery to the past trend, or possibly we have a kind of a L-shaped recession. It all has to do with the uncertainty that exists at the moment regarding the possibility of basically developing a vaccine and or kind of treatment. This is very basically at the moment very important things to have, and that's basically how the corporations and how the firms are basically thinking of. So another things to basically, uncertainty is one of the consideration that would shape the kind of the nature of recession that we would have. So if for example, it takes time to develop a vaccine as a result of basically people high unemployment, the economy would lose the economies would lose their production capacity and growth potential. Therefore, an L-shaped recovery, a recession would be basically more likely. Another consideration that is important to take into account is that the level of debt, the kind of intervention that the governments have made in the economies in order to stop the race between supply and demand, has created enormous public debt. And of course, when the recovery comes and the economy goes back to normal, these high public debt could actually reduce public investment in research and development, in education, in health. So the impact of the recession could be long lasting, even if the basically we have a vaccine and people go back to normal because of the high level of debt that we have. The expenditure in certain area, public areas like public R&D, research and development, or education and health would most likely be decreased. So the economy most likely move on a different path, and it takes ages to recover. It takes the economy ages to recover. So because of these two considerations, the uncertainty and debt, the kind of recession that we have, even if it's not that deep, it would take time for the economy to come back to normal. We could see still basically 5 more minutes regarding the firms, and then I stop. So what basically, when it's come to the firms, to the corporation, what happens actually during recessions? So one thing that happens during recession is that uncertainty goes up. So that's a key. Recessions and economic crisis always associated with high uncertainty, and so uncertainty goes up. All the indication basically here, this is the graph that we have. Is one of the measures that we have for measuring uncertainty. You can see at the end of the graph how actually uncertainty has gone up, for example, in the US. So one of the things that happened, one of the things that happened during the recessions is that the uncertainty goes up. When uncertainty goes up, that I mean, the cost of capital goes up. The banks are not basically willing to lend to the corporation and firm at a low rate, and access to credit also become limited. So during recessions, during economic crisis, uncertainty goes up, and as a result of that, the cost of capital that the firm need during the recession goes up, and access to capital also would be more limited. So as a result of that, the firms that have a high debt, basically the firm that basically built enormous debt before the recession, this type of firm are likely to go bankrupt. So there will be bankruptcies inevitably, as we had in the past recession, during this recession as well, particularly when the government support basically ends. The uncertainty remain, the high cost of capital remain, and the limited access to credit remain, and inevitably would have basically some bankruptcies. This is indeed what we see in most recessions. In most recessions, one of the key things that happen after recession is corporate failure. A large number of basically firms go bankrupt. This is what happened after the Spanish basically pandemics. You can see how the number of failures, corporate failures, firm failures after the recessions basically went up. The same thing we saw during the financial crisis, 2007, 2009. The uncertainty went up, access to capital went basically very limited, and the cost of capital was basically high. The banks, even though the interest rate was low, they were not lending to the corporations, and as a result of that, the firms that were highly debted, the corporation that were highly debted, they went bankrupt. That's one of the things that we have. Another thing that happened during the recession is that the investment goes down as well. So corporate investment, firm investment, is positively related to their profit, to their revenue. And because during the recession and after recession, the profit of the firm goes down and also uncertainty remain, the firm reduce investment. So corporate investment goes down for two reasons. That as when there is uncertainty, the firm actually they keep their cash, they increase their saving to become safer, and also they don't have much revenue for these two reasons. Investment basically goes down. That's another thing that what basically happened during the recession, and saving goes up. So the last slide that I'm going to explain, of course, employment is a challenge. So this is the graph that we have in the US. Almost basically 24 million out of job at the moment, and 14 million of them have lost their job. And this indicates that the recovery actually would be quite basic. It takes quite long, because when you lose your job, it really takes time to recover the job and to match the unemployed between basically with the firms. So after the financial crisis, almost it took basically 6 years for the US, so that they reached 6.5 to 7 years to basically to have the same level of unemployment that they had before the crisis. Most likely, because of the number of the fraction of the workforce that they have lost their job, it would take a lot of time, a long time, to recover these jobs. And for that reason, in many countries, this recession would be basically much longer. So this is what basically we have at the moment. This is the big picture that we have regarding the current recession. And there are lots of details here, lots of discussions here. Different countries have different policies, but I try to give a kind of framework how actually we need to think. So one way to basically to think about the current situation is to think of the different type of recession, the V shape, the L shape, the U shape, and build an argument in your current context which actual type of recession is more likely in your situation. So I end here. Hopefully, I had a few points for you to take away. I end here, and I would be happy to basically answer the questions that you have. Again, thank you very much for joining us today. It was a pleasure to talk to everyone.
Great, Dr. Reza, and it was quite an engaging session
Thank
because
you.
I can see a lot of comments coming in wherein the audience is picking up and specifically mentioning the words like very interesting. Thank you for sharing. And there is a pool of questions, and I will pick up quickly for you to address.
Thank you.
So the question is from one of the audience: what do you think would be the best approach to revive an economy after recession if the demand does not go up significantly?
Definitely, we have to go back to the source of the challenge, the fundamental challenge. The fundamental challenge is uncertainty. Is testing and tracing is the most effective approach to help the economy recover. So the government across the globe had these policies to so that the health system is not overwhelmed and the health system can cope with the pandemic. Know that they have managed pandemic. They have to basically put a system in place that they can increase testing in the population for the virus, strongly high level of testing, as basically Germany has planned, as South Korea has basically started doing it. High number of testing on a daily basis, and quickly isolating those who are basically infected. This return a level of normality and certainty in the economy. If you put that policy in place, you are more likely to reduce uncertainty and the demand would go up. At the moment, there doesn't seem to be any alternative except testing and tracing and isolating quite quickly.
Mhm. Can the adoption of digital technology slow down the disruption in the supply-demand cycle in such a crisis?
Yes, different, of course. I mean, and so the retail, for example, imagine we did not have these technologies, then the retail sector would not be able to continue normal operation. So in this pandemic, for example, the demand for Amazon has gone up. Or the demand for Alibaba in China has gone up quite significantly. So in that way, yes. Or look at the higher education system. So although in a sense the universities are stopped, but we can still have a level of communication with each other through online teaching. So definitely in that sense, the digital technologies help a lot. Imagine we had this recession 20 years ago, we couldn't have actually talked to each other. There was no Zoom, there was no GoToMeeting. So in that sense, the digital technologies have enabled us to reduce the negative impact of this pandemic or this virus on the economy. That's one approach, one way that these digital technologies have already had a huge, basically created a huge help to us to continue to some extent operating the economy. The other dimension is also interesting is that the apps that are being tested or basically is going to be tested in different places, like in Germany, in the UK, that enable us tracing who is basically, if you go to, for example, in South Korea, they implemented these apps that captured your interaction with others. So if someone has a virus, you can tested positive, you can immediately look at the data and trace where who was basically in touch with and test those people as well. So definitely is we are lucky to have these technologies. It's enabling us to deal with the virus more effectively, definitely.
We discussed about the shaped recovery, the L-shaped recovery. There's a question which is coming in, wherein the audience wants to know what about the W shape of economic recovery, which is argued by
Uh,
several scholars, and how can
that's
it build up our plans?
that's right. So in order to actually uh, to manage the talk, I didn't mention that one as well. So W means okay, you have a sharp decline, and then you control the virus, and then you open up the economy because you don't have medical treatment or a vaccine. Then the economy would experience another wave, and then you have to shut down again and shut down again, and, and open it up again. So if you look at uh, 1918, when we had this influenza pandemic, there was multiple wave, and the kind of experience that the economies had come quite close to V-shape. Very likely, again, that has to do with the uncertainty that we have. Is we really don't know how this virus actually is going to operate. I think we need to wait for a month or so to see what is happening in Germany, what is happening in South Korea, and also what is happening in China. These are the countries that they effectively dealt with the virus, and then they open it up. So we have to see whether they would experience another wave of infection or not. So it's that's also a possibility. That's definitely also a possibility. So I mean, my purpose was to give you some conceptual model so that you can think about the decision.
Perfect. There's a query on how can we mitigate risk post-pandemic in transportation industry, especially public transport.
So again, this is what is unique regarding this recession is that the uncertainty is from outside the economic system, it's not from inside the economic system. So the uncertainty that we have has to do with it, basically how this virus operate, or when we would have a vaccine, that we have it. So because of that, the level of risk would definitely remain. But there are certain policies that mitigate these, like for example, wearing mask. There are increasing evidence that would help, or distancing in aircraft and these things. I really can't think of anything else at the moment. So the investment that some of these European countries are making in using bikes or using basically e-bikes, these are the sort of measures that comes to mind. But I think I am in the same boat that you are. I don't have the answer to that question, and the reason is that we really don't know how this virus is going to behave. So it's very uncertain. I don't have an answer to that question.
I understand. Absolutely correct. Because it is going industry specific as well,
That's
and
right.
the uncertainties are definitely prevailing. I'll move on to the next question in queue, Dr. Reza. Although we are running out of time now, if you allow
Yes.
me to pick up one or two questions.
Wonderful. That's good.
Uh, Wonderful. So there's a question which is, in fact, a couple of questions have come up regarding supply chain management. So a query says that the supply chain for some countries were affected. So is it time now for countries to think about a different approach in supply chain management, like regionalization?
Um, it's a very good question. I think we need to look at the data. So the initial shock started from the supply chain, but the data that is coming out is that um, is the race between the supply and demand that was the issue. The supply chain actually is not that much disrupted. Is okay. It's actually continuing operating. So the first thing that I have to say is that always we have to look at the data. There are lots of basically things written in newspapers and other places that the supply chain is heavily disrupted and these things. we have to be very careful. We have to look at the data. At the moment, the data is quite scant and limited, but the limited data indicate that the disruption in the supply chain was not as great as we started. Look at this, the perception is also quite important. What actually we think that derives the economy. At the start, everyone was thinking that the supply chain is heavily impacted, but that's not the case. Indeed, there's a positive actually side to the supply chain because of the effective global supply chain that we had. We could outsource ventilators and other equipment much quicker. So we can also look at the positive dimension of it. Whether basically reshoring would be a solution or basically regional supply chain, I'm not confident about it because um, uh, is there are lots of good benefits from the global supply chain that we have all benefited from: low prices, basic economies of scale, low cost. And in this world, there is always trade-off. If you bring it in, then you can't have the economies of scale. You can't have that basically competition along the supply chain and low prices. So you have to, okay, if you bring it in, reshoring, you might reduce the risk, but that risk reduction comes with a cost. You have to trade it, basically, um, uh, strike a balance between the cost and benefit, and have a cost benefit analysis when you're thinking of supply chain. We should think like an economist. Look at everything has a cost, everything has a benefit. You have to strike a balance between the cost and the benefit, and also always pay attention to data. The data does not indicate that the supply chain is heavily uh, impacted or was not as in risk as much as we initially thought.
Okay, I'll take a last question, Dr. Reza, so that we can be within the time grounds as well. There is a query: is there model to find an equilibrium between acceptance, referred as suppression of health cost risk, and containment, referring to lockdown?
Yes, it's been extremely basically a productive time at the moment. So there are lots of good models are coming um, out. So this model, for example, is from MIT uh, economics department. I did not go through it because we did not have time, and it's a bit complex. So there are some complex models that have started coming out, and then they are, um, capturing the concern that basically all the student or audience basically have. So most of the models that have come out so far is to capture basically this, but some models just recently this week is coming out that capture the impact of economic policies as well. So if you, there is a website called Vox, VOX, Vox Economics. If you search web and go to that website, you can, on a daily basis, uh, see a summary of some of these models that are coming out.
On that note, Dr. Reza, we have to now bring it
Thank
to
you.
an end.
Wonderful. That's
I
great.
totally appreciate your valuable input. Yes, there is time of challenge around. People and government and processes are going under changes. Things are working out to the betterment of
Absolutely.
humanities.
Absolutely.
Yes. And I think
Absolutely.
we all are very positive and quite hopeful that things will fall
Sure.
back normal very soon.
Absolutely. I think the pessimism always add to the problem. It worsens the situation. It's the optimism that can solve the problem, not the pessimism.
Mhm.
Particularly this difficult time, if you are confident, you are basically optimistic, then you come up with a solution, and there are always solutions. This is not the first time that the economy experienced a challenge, and it would not be the last time. With optimism, we can always actually overcome the challenge and continue to have a normal, wonderful life. Thank you.
Certainly. Thank you so much for your time, and to all those who attended the webinar, I am sure you are benefited, and thank you for your lovely comments you have shared in the chat box. It really makes us happy that we are sharing the knowledge and it is getting benefited to you. I would request you to, if you are interested into the webinars of similar pattern or something which interests your domain, you can follow us, you can visit our website, follow the events page, and I am sure that you will get a lot of information which is of your interest. So stay safe, everyone. Have a great evening. And once again, thank you, Dr. Reza. Please take
Thank
care
you.
of yourself.
Bye bye. Thank you. See you in Dubai
Bye-bye.
soon. Bye bye.
Certainly. Okay, see you then. Bye-bye.